Here's what your stomach issues say about you. Have you ever had back pain and then you noticed your stomach started to act up? Or the reverse, you've ever had back pain and noticed that your stomach started to hurt or have gut issues? If this is you at the moment, or if this has been you in the past, you will want to keep watching because I go through the reason why this happens, and the answer may be something you're not really expecting. Hi there, my name is Dr. Kristina Turkewitsch, and I'm a chiropractor in Newmarket, Ontario, Canada. I've been a corrective chiropractor since 2016, and I've seen a lot of these problems happening. And so today we'll be going through why this happens. If you are dealing with gut issues and have back pain, it's important to identify the root cause of this and address it at that level. Symptoms in one area of the body may be a reflection of a problem in a different location. Many people visit a chiropractor expecting only to deal with their back pain, but are surprised to learn when the treatment starts helping other issues. This is often the case when chiropractic treatment help with gut issues. Now, someone had to say it, and I'm going to be a little controversial here and say that most problems of the gut can be tracked to a spinal issue. If there's an issue at the spinal cord level or at the spinal nerve level, you will have an issue in the gut whether you feel it or not. And over time, that can just become a lot worse to the point where you start feeling the problem. Now, a range of spinal problems can cause issues or problems in other parts of the body. The spinal cord sends nerve signals to the rest of your body, impacting its function, and it tells all the other organs and systems how to work. So if there's a problem in the spine, and let's say that's in the low back, for example, then you'll have a problem, or you could develop a problem in any organ or system that is supplied by that nerve level. And a lot of people like to explain it as if, the gut issue came first. However, more often than not, it's more often the case that the spinal problem happens first. And for the most part here, I'm talking about uncomplicated back pain. So I'm not really talking about things that are of a genetic origin. That kind of is a little bit of a different story. So even if you are experiencing gut issues like pain or something else, even before the back pain starts, it doesn't mean that the stomach problem gave you the back pain, although it is related. So for example, let's say that you live on a river, and every morning you go down to the river and you see trash. There's trash on the side of the river, there's trash in the river. And so is the river creating that trash? Like, is that just coming out of the river on its own right at that source? No, right? The trash isn't being created by the river. It's coming from a source somewhere upstream, right? Because the water will flow only in one direction, so you'll have an issue upstream. And so let's say you hike up the river and you find the source, and at the source there is a campground. And what happens is everybody at the campground has been chucking their trash into the river. So if you think about the river as the spinal nerve and the spinal cord as the source, the campers throwing trash, they are the dysfunction creating the issue. So the campers are creating this miscommunication. And so if you're thinking about it, at the spinal level, you're having some sort of inflammation or pressure on the nerve. And it's resulting in something bad happening downstream or down the line. And so it's the same thing or similar thing with the gut. So if you have a low back disc herniation, if you have spinal stenosis, if you have discompression or bulges, or if you have a postural change in the low back that's creating compression and tension, so just to name a few things, this will affect your gut. And these changes usually build up over time, so they happen slowly, gradually over time. And so slowly, gradually over time, the constriction to the nerve gets more and more pronounced, Therefore, what's being supplied by that nerve becomes, like, the problem becomes there, the dysfunction becomes there, and it becomes more and more pronounced as time goes on. And a lot of the time, people are just like, I don't know, it came out of nowhere. I don't know, I never had this problem before, and then all of a sudden, right? So the lumbar spine and the lower back, as well as the sacrum, are really important here. And the sacrum is especially important when it comes to nerve function, because issues in the lower back, spine and sacrum can lead to symptoms like constipation, diarrhea, bloating, gas, or bladder dysfunction or malfunction. And this occurs because the lower spine includes sympathetic and parasympathetic nerves that connect directly to the digestive system. So interference directly affects their function. And this process can also work in reverse, although less common, honestly, as well. So if you are experiencing stress in an organ, or of the digestive system or any other organ really of the body, that organ will send messages back to the spinal cord, and they go through the same nerves. So you then will feel a symptom at that level in the back. So let's say even with a liver issue, or if you have, let's say, a blockage, right, in the bowel. So that information and that blockage happened probably because things aren't functioning properly again. So it goes back to function, but you will feel it in the low back. And so unlike other interventions like medication and surgery, chiropractic care is really minimally invasive, right? It's very natural, it's very holistic, and this is a much more gentle approach to treating these issues, because it's working to, towards sustaining a long-term fix. And so it can take some time before you notice things start to resolve. But a lot of that reason is because the issue has been there for a really long time to begin with, and it's only finally showing symptoms. So it can take time to heal that. So thank you for watching. If you found this information valuable, please let me know, give it a like, or leave me a comment below. I'd love to hear from you. So if you have questions on any other issues that might be spinal related, please leave me a comment. I'd love to chat with you. Otherwise, check out my next video on how you can help toxin release after a chiropractic adjustment. Talk a lot about the liver and the lymphatic system, and so I think you'll really enjoy it. So check it out. I'm going to put it up here on the screen.